Hello, my name is Nikhil Agarwal, and today with us we have a pediatric doctor. His name is Dr. Krishna. He has been a practicing physician for over 25 years. And before we begin, would you like to maybe say a couple things about your office and maybe like the general age groups of patients you work with?
Sure, Nikhil. Thank you for having me. I'm Dr. Krishna Madiraju. I'm a general pediatrician. I'm a board certified pediatrician. Our offices are Century Pediatrics. I'm the president and founder of Century Pediatrics. We have multiple locations in Northern Virginia, in Herndon, Woodbridge, Stafford, and Fredericksburg. And we cater to the needs of children from newborn age to almost 21 years of age. Yeah.
So teens and below.
Yeah.
You came from India and you already were a licensed doctor there and you graduated from Osmania Medical College. But in America, when you transitioned over, did you have to go through the entire process again, or how was that like?
The journey was incredible. I mean, it's an amazing journey. I did my medical school training in Osmania Medical College as a neurosurgeon at Nizam's Institute for about 8 months or so. And then I came over to United States to do my pediatric residency training. The pediatric residency training is rigorous. It's about 3 years long. And I did it at State University of New York, which is called Downstate Medical Center. And we rotate through, for 3 years, we rotate through different pediatric subspecialties. In a way, we learn medicine all over again, but more specialized towards children, right? So we rotate through pediatric cardiology, which is like hearts, pediatric pulmonology, which is to do with the lungs, endocrinology, all the hormones and stuff like that. And we also rotate through the intensive care units. There is a pediatric intensive care unit, there is a neonatal intensive care unit, and also the pediatric emergency department, which is one of the busiest emergency departments there. This gives like a wide exposure to handle like all kinds of problems. So after I finished my residency here, I started my practice, and I've been in practice for more than 25 years. And I've held like several positions as a chairman of pediatrics and vice chair of some pharmacy and therapeutics committee at Virginia State Medicaid and all those things. And all this has helped me prepare very well to handle most of the things that we commonly see in pediatrics.
When you came from India to USA, how many years did you have to dedicate back into studying in medical college?
In India, it's usually like 5.5 to 6 years to study medical school, right? After I came here, it's an additional 3 years. So I would say 9 years. But I think in practice, as I told you, I've been in practice for 25 years. Every day you learn something new. And that's the beauty of medicine. You learn from your patients, and you need to like keep yourself abreast, reading journals and articles and stuff like that. So,
that's why it's called practicing medicine, because doctors keep practicing throughout their lives.
Yeah.
So after you graduated and you were able to start your own business, how long did it take for you to open your own office?
I worked with another physician just to like learn the trade. I would say it's an art. Medicine is an art and a science. So I worked with another doctor, but what really helped me prepare for my own practice was I was working in the pediatric emergency department at Prince William Hospital, and I was the director of the pediatric emergency department. And at that time, it was a new concept. Like, most of the times the emergency departments are just meant for adults, but we started something called Kids ER, right? So patients who are coming through the ER, they didn't have to wait along with the adults in the line. So we call it ER Junior, okay? So we just, as the child comes in, we just triage them into a separate area of the hospital, in Prince William Hospital, and we had this ER Junior where we would handle injuries, sutures, right? And then fevers or any of these. So that gave me a valuable experience, and I did it for almost 3 to 4 years. Yeah.
So now that we know a little bit more about what you have been doing and what practices you've been with, what would you say has been the most exciting and the most fun part about being a pediatric doctor?
I think pediatrics is a wonderful field, Nikhil. If you ever want to consider it, I would highly encourage you to do that. It's very satisfying, very satisfying. Children are like flowers, okay? Children are like flowers. You give them tender, loving care, and they bloom, right? If you don't take care of them properly, I mean, of course, like a flower, they're wilt away. But the beauty of pediatrics is that you could make a positive impact in the life of a child. All the children are, they're our future, right? A child is the future of our country. So I get to shape the future of this wonderful nation. So that's every day I wake up, I pray to God for not only for myself and my family, but for my patients too, right? And I go in so that I can prevent the problems before they occur, okay? And during preventative care visits, in pediatrics we have two types of visits. One is like a sick visit. You come with a cough, cold, ear infection. But I get really excited about well checks. Well checks is when a child comes to you not knowing what they have, but they just came to you and they're in front of you, and that gives me the opportunity to discover things and talk to parents about how to promote their health and prevent disease in the future, like way into the future.
So you get to kind of follow them throughout like the early periods of people's lives.
That's so true. So what we do is a continuous care from birth to 21 years. When my patients see me, they see me, right? So they see me and I see them growing. I mean, sometimes the babies come with weight of 6 pounds. Imagine a small baby, and each week it's entirely new patient. Now they're 7 pounds, the next week they're 8 pounds, and then suddenly they're 10 pounds. It's the wonder of life happening right in front of your eyes, and we track them longitudinally, and that way we can intervene if suppose something is not looking right. A trained eye, over 25 years of experience, I can see if some child is not able to not following the trajectory of growth, development, or if some mental health issue comes up, I can detect it. But the key is to be consistently seeing the pediatrician so that the pediatrician can guide you, and say that, hey, your kid is supposed to be doing this at this age, but they're not doing it. And that means, let me get an opinion from a specialist. And then coordinate that care with all the specialists that I know of so that we can fix the problem before it becomes a major problem.
So moving on, now we go on to like a more of a topic which is much more relevant in present time because it's more so about vaccination, and in this time especially COVID vaccination. As we can all see around the world, COVID has impacted all of us. It's killed millions of people and it's impacted so many families. But ever since the vaccination has come out, it's provided a line of defense against COVID. So I know that there's a lot of people who are still hesitant out in the world, and they don't want to take the vaccine because they're not sure if it may impact them biologically, anywhere on the physical side. But what would be your take on, should people take COVID vaccines, or should they kind of hold back and wait for the results?
The simple answer to that, Nikhil, is yes. Okay. The question you asked is like a wonderful question. I mean, it's the burning question of the day, right? One cannot deny that COVID has killed millions of people all over the world. It's a real disease. I mean, there's no question about it. Now, the fear for parents, like why they're not taking this vaccine is, I mean, in their hearts, in their minds, it's very well founded. It's just a basic distrust of the system sometimes. Okay, they think that probably the government is experimenting on them. Sometimes they think COVID is a very mild disease, it's going to go away. Or they may think, oh, my child, I want to get a natural infection for my child, and then they will get immunity and get over it. But first thing we have to understand is educate your patients. When you are a pediatrician, for example, you have to not only convince the child, of course, we have to convince the child, and say that yes, you need this vaccine, but you have to convince the parents, sometimes you have to convince the grandparents, sometimes you have to convince the neighbors. So parents get input from various sources. And nowadays with latest technologies, they are reading information from all over, which scares them. And they are sometimes paralyzed by inaction. They don't know what, so they come to you as a doctor. So your job is to understand their position first, like what is their worst fear. Some parents fear that it could cause infertility, for example, and that's why they don't want to give it to their child. Okay, but it is unfounded. It's not been proven. In a number of studies have been done, and it has not been proven to show that it is causing infertility. So we need to educate the parent and say that look, the threat is real. People die, and we have the best defense, as you said, is vaccination. And vaccination is very safe. And you know, I do read articles, but I ask my patients too. I say like, hey, you got your first dose. Children always tell the truth, right? Children always tell the truth. So I asked the patient, like, how are you feeling? I said, I didn't have a fever. I didn't have pain, nothing. Okay, so they're here for the second dose, for example. I asked them, how did you feel with the first dose of the COVID vaccine? I'm not asking about a different vaccine. I said, they're completely fine. 5 to 11 years of age, they have tested like of this vaccine in thousands of children. Nothing has happened. I mean, nothing has happened. Nothing major has happened. Even over 12 years of age, there have been like minor reports here and there, but everything is reversible. Okay,
So even though it's like a new type of technology of vaccination, because it's mRNA-based vaccination, I guess people are still a little bit afraid because it's new technology and they're still a little bit unsure. Like, what are the long-term effects of it? I mean, there have been a couple of reports of how people have, passed away because they got blood clots because of the vaccination. But were those proven to be related because of the vaccination? Was the vaccination the cause?
Some types of vaccines in some individuals, like who are predisposed to cause. So there are a lot of rare things which have to happen for something like that to happen. But for the general population, yes, it is pretty safe. Okay, so I would not say I say like this is the best defense that we have against this virus. And I think if more people get vaccinated, it will give them a better protection. If you have if you look at if you have a pre-existing condition, right? Pre-existing condition is like diabetes, pre-diabetes, right? Or obesity, like a lot of people are overweight. Okay, those kind of people, COVID tends to kill more, right? So those kind of people, it becomes very, very important, right, to get the vaccinations. It's like almost like children with heart problems or lung problems like asthma. You can save their life by giving this vaccination. Okay, and somebody could work on losing some weight, but it's going to take a very long time. In the meantime, you could get a disease, and then you can still get the vaccine and still work on reducing weight and all those, controlling your glucose if you're diabetic and stuff like that. But getting the vaccine is the first step. And if you have any doubts in your mind, I think you should, instead of spending a lot of time talking among yourselves, I think better to go and talk to the doctor, specifically ask a question, and the doctor will be able to address your concerns and tell the patient, is it good for you or not?
So if, let's say, somebody doesn't have some very overarching, and they're predisposed to something like diabetes or obesity, which you would again recommend even to these people to get the vaccine.
It's very important for them because they are the vulnerable population. If you look at it, the single best thing next to vaccination that you could do is lead a healthy lifestyle. And this is not what's being pushed to parents, right? Exercise, walk a little bit more than what you used to, eat healthy food, lose some weight, control your glucose, right?
Yeah, very typical things in modern
very
society.
typical. It looks, but we are not stressing that. Yes, vaccination is very important, but this is equally, if not more important. It's like to wake up. We had like very close family members who had like pre-existing conditions who passed away, unfortunately, because they had pre-existing conditions like kidney disease and obesity and stuff like that. And it hurts a lot to lose someone to a preventable, now I would call it a vaccine preventable illness. Okay, we have to learn to live with COVID. It's becoming endemic. You know the difference between pandemic and endemic. Now it's going to be like the seasonal flu, and this virus is smart. It's changing. It's changing. We see so many variants coming, Delta variant and now the Omicron and stuff. So it's trying to adapt and it's going to change, and we need to be also changing too. We should not complain and say, oh, now they're asking us to take another vaccine. Okay, just the way the flu vaccine jumps, let's say you're here and you got the flu vaccine and you never got the vaccine, right? And the flu virus has been jumping, and then there is a whole population who were never protected. Now we're going to have a flu pandemic. The same way, when you get the COVID vaccine, first dose, second dose, third dose, you're jumping along with the virus. As the virus moves, you are also moving. If you don't move, then you are left behind. And then that means the new variant which is going to come, you're going to be really far away in terms of protection from the new variant.
So you'd be higher at risk
from these variants. You must have heard like some people have the vaccine and they still got the Omicron variant, but it's mild. It's not like life-threatening for those individuals who got the vaccine. People who didn't get the vaccine, they got a very serious illness even with the Omicron variant. Previously, they said children are not going to be affected with the Omicron variant, right? I mean, with the coronavirus, children don't even need to get. But so many kids. I mean, I literally was like, I was feeling like I was fighting a war. Like it was like a war zone in our office, taking care of so many sick patients. Yes, COVID does affect children. Yes, the children need to be protected, and we have to educate the parents who don't want to, get the vaccine out of fear. When it is, sometimes it is irrational fear. I have also heard some parents say that, oh, my child got the Omicron variant, now they are protected. They will get natural immunity.
That's not true. There's so many variants.
You're so right, Nikhil. That's what happens. You could get Omicron today, right? What if there is a new variant tomorrow? You got the Omicron, but then the virus moves. You have to move along with it. So that's the message. We need to sit down and talk with the patients. Yeah.
So in your office, like I'm pretty sure you mentioned this not too long ago, but you were saying that it was almost like as if you were fighting a war in your office against COVID specifically?
There was, it was, I mean, the influx of COVID patients was huge. Influx was, I mean, literally, we couldn't even take time to like eat lunch or drink water. That's how bad it has been for pediatric practices. And I sincerely applaud all my colleagues. I'm part of the American Academy of Pediatrics and American Board of Pediatrics, Virginia chapter of American Academy of Pediatrics. I mean, these doctors and the staff, like the staff in our office, have poured their hearts out trying to help patients. In the hospitals, the nurses are like getting tired taking care of so many sick patients from a preventable illness. You see, something which could have been easily prevented. The severity of it could be easily prevented by taking a vaccine or treating it early in the course of illness.
Okay. Not waiting until the more serious of the side effects come.
So that's one thing that I wanted to look. I led like a initiative in telemedicine, helping people in India actually, like online. And we did a pilot project in a small village in India. As soon as the COVID was diagnosed, they contacted us and we were able to say, this is what you need to take. We trained people what happens in COVID, like how it affects your heart and how it affects your lungs, okay? And catch them by day 5 and started them on anticoagulants and medications before their saturation drops. And we were able to reverse the death rate to the point that the government came and asked, can you please do it for the entire district?
Wow.
So those were amazing results. So early treatment, God forbid you forgot to take the vaccine, but early to go to your doctor early. And then by day 5, you're still having symptoms, then you need to, move forward and then get treatment early. That's the thing.
So like you just said that, especially in those people in those districts, you were seeing that people are having problems with the heart and respiratory because, I mean, COVID affects those things. But because you saw so many patients in your office, and because you follow them through life, have you seen maybe any long-lasting effects on children because of COVID?
I have seen like some kids get like really sick from COVID. Okay, there was this family wherein the dad passed away, right? The grandparents passed away from COVID. The whole family got it. This child, in front of my eyes, she got like worse, and then she needed ventilation. So the kid needed a tracheostomy, but when you're asking me about the long-term effects of COVID, I think it's too early to be seeing those effects. Okay, long-term effects of COVID could range anywhere from heart problems. We are already seeing a lot of kids developing myocarditis. Myocarditis is inflammation of the myocardium. Myocardium is the muscle of your heart. So inflammation of your heart is myocarditis. So we're seeing a lot of that in some children. Okay, so we're referring them to a pediatric cardiologist whenever we see something like that. Also, we're seeing a lot of tiredness, weakness, insomnia, lack of sleep in young children. But again, only time will tell what is the long-term side effects of COVID. Yeah.
When you were talking about this girl, how the entire family got COVID, her parent or her father passed away and her grandparents passed away. You could even say that side effects of COVID may not just be on the physical state, but also on the mental state.
Oh yeah, you're absolutely right, Nikhil, because imagine losing someone in your family. It's going to be devastating to the child. Their social support is lost and they get scared, not knowing what's going to happen. And even if something that severe doesn't happen, look at what COVID has done with the closing of the schools, right? Children are unable to go to the school, right? And they are in the home, social isolation, they're not able to interact with other children or their friends. This is creating a pandemic of bigger proportion, right? With mental health issues blowing out of proportion. And I was reading the other day, the suicide rate in girls almost doubled in this from 2019 to 2020. Okay, and which is like, I think it's high time that parents pay attention to like what's going on in the lives of their children. What are the stresses that the child is going through in their lifetime? Some children, they don't sleep until like 2 o'clock in the night, right? They're talking with their friends. There's so much going on in their life, and we need to pay particular attention to that.
So pretty much that, especially for the girls that you were talking about, suicide rates have increased. That would be because of stress, anxiety, and just like because of like the social things which are going on nowadays because of COVID.
Yeah, and the effect of social media, what social media is doing to our children, we need to pay particular attention. They're essentially experimenting on this generation of children. So different algorithms. Okay, you take a typical teenager. 20 years ago or 15 years ago, they used to go to school, come home, do homework, play a couple of sport, go to sleep. But nowadays, it's rare to find something like that. Kids are multitasking. They are doing their homework on a screen, not on paper and pen. They're doing a thing on the screen, and then they have constant text coming through, and they're being like having to deal with it, and every time they're distracted. So ADHD is going up, attention deficit problems are going up, anxiety is going up, depression is going up. And then sometimes it's because the children are like comparing themselves to the other children. Oh, this girl has a boyfriend, I don't have a boyfriend. Or this guy has a cool shoes, I don't have cool shoes. Because everything is instantaneous, everything is instant gratification. Oh, this post has 100 likes, I only got 20 likes. So it creates a sense of dissatisfaction among young people, right? And they don't know how to deal with it, and most of the times they're shut in their homes, in their rooms, and parents think they're like, doing their homework, but yes, they're doing their homework, but they're also dealing with so much stress which is beyond comprehension. We see the effects of it every single day. I have at least 1 or 2 kids coming into the office saying that I'm bored. The moment a child says I'm bored, that means it's like they are getting into depression. And then luckily we have tools available to detect these mental health issues. Okay, simple questionnaire. There's no blood test yet, right? There's no blood test, but simple questionnaire that we can hand out to the parents, and while they're waiting in the waiting room, they can fill it up. 17 questions. It's called PSC 17, and then it will break it down into: is this kid having hyperactivity, ADHD? Does this kid have depression? Or does this kid have anxiety? Or this kid is completely normal? So this is like a simple questionnaire. Tools are available. So please come and talk to your doctor, right? And any good pediatrician can go break down this, and then if they find something wrong, they can take you to the next level and say that, look, your kid looks like they have ADHD. There is another set of questionnaire, right? And before this meeting, we were talking about neurotransmitters. You were talking about neurotransmitters. Mental health has everything to do with neurotransmitters. My knowledge of being a neurosurgeon puts me in a unique position. Like whenever I see a kid, I can see which hormone is overworking or which neurotransmitter is underacting or getting depleted. And then it becomes so easy when you think of it in terms of that and explaining it to the parent or the child, that help is available. The treatment is very simple. They don't have to hide behind closed doors. And I think the biggest thing is isolation. Children think that they are the only ones who are going through this problem.
But this isolation is also enhanced because of COVID, because you're constantly being locked inside of your home. You can't go to school, you can't go meet your friends or anything.
So true, Nikhil, because with this pandemic being forcing children to stay at home, this isolation has multiplied, and most of the children and families are suffering in isolation. But the bright side of it is help is available, help is on the way. It's the moment you say that, yes, I have a problem, 50% of the problem is gone. Then you will get people like me and somebody else who can help you get involved as part of a team, right? I can send you to a counselor, I can send the child to like a psychiatrist, or I can send them to meditation or something which is can help. Like there are multiple modalities to help this child, but not doing anything and hoping that thing is going to go away is going to just make it worse. And suddenly you will wake up one day and then see that the kid has committed suicide, and that's like devastating to the entire community. And then, but these are all preventable. These are all preventable.
So even though that suicide rates have gone up, there's a lot of mental damage because of COVID, not just because of impacts of COVID, because of the results of COVID. Society in general, it's hard to phrase this question, but how would you, there are ways, like you said, about screening for depression to make sure that the child is fine if they are depressed, but on a large scale, how would you do it across the world?
That's a great question. See, Nikhil, sometimes I'm amazed by your questions. Really. I mean, this is how I think lawmakers should be thinking. This is how pediatricians should be thinking, not on an individual child's level, but how do we bring this availability of technology at a global scale, okay? Resources need to be put into finding answers to these questions, right? We now know this, yes, we have the technology. So some of the solutions, I mean, your generation probably has to solve these problems, okay? Some of the things which I could suggest is maybe we need to take this allow the pediatricians to come and screen patients, students for mental health conditions, okay, in the schools. It's just questionnaire, right? Simple questionnaire. Parents can be emailed that questionnaire, they can fill it up and then send it back to your pediatrician. Somebody in the pediatrician's office can score it, find out what the problem is in a very, not affecting the patient's privacy, right? In a discreet way. So get the questionnaire done, get the screening done. If you find a problem, get the treatment. It's as simple as that. It can be done. It just needs policymakers, school administration, pediatricians, and parents need to come together and solve this issue. But if you're not doing anything, it's going to make it worse. We'll have an entire generation of children who are going to be left behind.
I guess that lawmakers and parents do need, and a lot of people, especially the adults, do need to come together. But I also feel that people have to have a lot more trust to be able to trust their health. People who help them, like doctors and pediatric doctors as well. People need to trust health professionals. First of all, I mean, it's one thing giving just a survey to a student, but then how are you able to trust if that survey is accurate, though?
Yeah.
So because in society nowadays, it's like people don't want to show, people want to hide secrets. They don't want to tell others, but I think because they don't think that it's going to be accepted in society as a whole. But if people do have a problem, they need to kind of, okay, don't tell everybody, but at least you have to get help. You have to talk to health professionals.
Yeah, I think again, your suggestions are up to the point, Nikhil. It's like there's a saying, it's called Satyamev Jayate, right? Truth endures, right? Truth endures. Truth will always liberate you. You come up front and say that, look, I may have a problem. Please, I want to get screened discreetly in a private, you are coming to a doctor's office, like your own doctor's office, schedule like a well-check appointment. You're supposed to see your doctor once a year. Just fill it up and only you and the doctor will know about it, right? If nothing is there, you will get a 0 score. Out of those 17 questions, you will get a 0 score. There's nothing wrong. Everything is happy. Go home, right? Just like getting a COVID test. You got a negative COVID test. You celebrate. You're happy. The same way, you get this screening done at your doctor's office. If it's negative, then you're happy. But if something is there, you need to act. You need to accept that there could be a problem. Go to the next step and get checked. In that next step, it may show that you don't have anything, and then again, you don't need to worry. But I think the point is, we have to first again say, yes, there is a pandemic of mental health going on, okay? And there are, yes, tools available, and it can be handled.
I think that's just something that people need to see, that if they are willing to give a shot to health professionals and actually trust them, there is a solution to the problem.
Definitely there is a solution, yeah.
So now we go into the more interesting part of today, and that is, we've talked about COVID, we've talked about mental health, we've talked about impacts of COVID, but what has been, out of your more than 25 years of experience, what has been some of your most challenging cases that you've seen?
That's a great question again. Nikhil, over the years of our experience, I have seen, I would remember couple of cases, a child came in with the parent, 9-month-old, just laying there for a well-check examination. And I was examining the patient, right? And just something comes into your mind saying that, I'm just telling you how the doctor is thinking, okay? It's very important. Something came to my mind, this child doesn't look normal, right? We see hundreds of children every day, every week. So you look at that child and the eye is just moving. It's called nystagmus, the eye is moving horizontally. And then it's wow, just by examination. So this is what a trained eye can pick up. And this is what clinical skills are. That's why medicine is an art and a science. I sent this kid to see a specialist, and then it turned out that this kid had like a brain tumor.
Oh, wow.
We had to send this kid to Children's Hospital, and fortunately they were able to do the surgery. And years later I was able to see this wonderful child, right? And she had to go through a lot. She had to have a tube in her throat and everything. But it's so rewarding, and because like you paid attention to something as simple as looking at the eyes, right? And the parents have no clue that something is wrong. They just brought the kid for like a 9-month examination. In another instance, there was a kid who had like gone to like the school and then fainted, right? And then they took the kid to the ER in Richmond, and then like the ERs did observation for 24 hours, sent the kid home, right? So I saw the patient in the office, and then while I was examining the patient, the history struck me like, why would a kid just faint like that? So we have to listen. So I told you about like watching observation, but listening to the history. What happened? Oh, I was just walking there and I just like fainted. Okay, how long were you fainted? Oh, somebody had to pick me up and take me to the ER. By the time I woke up, I was in the ER and stuff like that. Is that normal? No, right?
For a healthy young person.
For a healthy young person going to school. So that struck me, and I said like, let me listen to the heart a little bit more carefully. And then I called. This is a true story, right? So it was like this. I called the cardiologist. I sent this kid all the way from Fredericksburg to Reston to see one of the pediatric cardiologists in the area, and they found that this kid had like a heart block. It's called Brugada syndrome, in which like the electrical conduction system in the heart was messed up. So normally the heart impulse starts in the in the atrium, like the upper chamber, and it spreads to the entire heart. So this spread was being interrupted by some alternative channel. So they had to do electrophysiology studies and figured it out. And lo and behold, after this kid needed like a heart, they had to put like a special equipment that would like shock the kid and make sure that this thing gets corrected. And later on, the kid went and had like a radio ablation, like basically they removed its extra tract so that the impulse of the heart would go through the normal channels. And later on, we found out that the sibling also had the similar problem. So we were able to save, with one shot, we were able to save 2 children. So this, I think, just shows the power of listening to your patient. Listen carefully what the patient is saying. The biggest mistake the doctors do is they don't listen to what the patient is telling. If you just listen, majority of the problems will be solved, because the patient is trying to tell you, or the parent is trying to tell you what's going on.
And
Right?
when you said that they had to keep some sort of a device, was that a pacemaker?
It's kind of pacemaker, yeah, which was like, which it had to like jumpstart the heart kind of.
Okay.
I mean, now the technology is really amazing. They can, see, normally if you do an EKG, like an ECG, it will just check the electrical impulse in like a 30-second span or 20-second span of time. But now they can hook you up with a monitor. Okay, it's called an event monitor, and they can check your heart rate over a period of 24 to 36 or 48 hours, right? Sometimes whole week. And then every time you feel something wrong, you can click a button and then it will record, and remotely it will go to the doctor, and the doctor can like find out like what's going on at the time you're having the symptoms, right? And they can take a reading, and then it's called electrophysiology, and they will see like what the heart is going on, I mean, what the heart is doing. Another interesting patient I had was again a regular examination. Now here I was examining this like 12-year-old kid, and then I said like lay down. I just laid my hands on the belly, and then I was feeling it. I could feel like a small mass in the abdomen, right? So again, this is like, I told you about history, then observation, and then this is the physical examination part. This kid turned out to have like a kidney tumor. What I'm trying to say is like regular physical examinations, very important with a trained person. this kidney mass turned out to be non-cancerous. It was taken out, and then the kid was completely fine. But the most challenging, which I think, most challenging condition, which I think I would like to find a cure for before I die, is autism. It's like, it is like when I first started looking into this, like kids were getting at 1 in 200 children were getting autism. Then it jumped to like 1 in 150, and then it jumped to 1 in 100. Now it's 1 in 60 or 1 in 50. The last time I looked at it, it's like every day we are seeing children coming in, and parents are in denial. The worst part is, like, I can see it very clearly that the kid has some problem, and we try to tell the parents, hey, something is wrong with your child, but sometimes the parents don't want to accept it. They think that, oh, let me wait and see. But as a pediatrician, we check the development of a child at 2 months, 4 months, 6 months, 9 months, 1 year, 2 years, 3 years. Like, the kid is supposed to do certain things at each age, right? Suppose a 1 year child is supposed to get up and walk. They can do it at 15 months, it's okay. But let's say a child doesn't walk until like 2 years of age. Is there something wrong with it, right? Something is wrong. So the same way, this is not motor development we are talking about. We are talking about the brain development. We are talking about how the child, like if the mom is trying to call a child at 1 year of age and says, Tommy, and then the kid doesn't turn and look at the mom, then obviously either the hearing is a problem, right? Or something else is going on, right?
So understanding of certain sounds, I guess.
Yeah. So we need to raise awareness about autism, okay? We need to put more research into like what neurotransmitter is faulty in kids with autism, which is not being done. I've been appointed by the governor of Virginia to the Autism Advisory Council. Like, I'm on the Autism Advisory Council. I sit with lawmakers, and we come up with a budget to help families every year. But majority of the budget is going towards treating after the kid has autism. But my point is, like, we need to be spending more money to find out what is causing autism. If a child with autism is born, into a family, and once the autism is full blown, we don't have the technology to reverse it. If somebody has COVID, you could give them, a vaccine to prevent it, or you could treat it, and then few days later they will be better. But what about autism? There is no treatment. So the most challenging thing, which I think for my generation at least, is like that we need to find a cure for autism.
And last question, but do you think that autism is more so caused because of maybe your genes? There's something faulty with the genes, or do you think it's more so related to neurotransmitters maybe not working properly?
To answer you, I think it's multifactorial. We don't know. Again, accepting the fact that we don't know, right? It could be genes in some case. Sometimes it could be parents are related, like it's called consanguineous marriages. But sometimes it happens to regular people for no particular reason. So is it environmental? Is this something, the food that we are eating? Is this something in the creams that people are using in the nail paints or nail polishes or stuff like that, or like in the makeup things that women are using? We really don't know where it is coming from, but we know that for sure we are seeing a lot of kids, and it's not artificial. Some people say that, oh, because we are screening more, that's why we are finding more autism. No, it's not like that. Imagine if you have a child with autism, the kid is like running around all day. Just the other day, I had a mom with, I think the kid is around 2.5, 3 years old. The child was crying non-stop in my office for 45 minutes. 45 minutes. And the mom was like really, like at end of him, she was like really, like she didn't know what to do. Okay. And imagine like 24 hours a day, if something like that is happening, we need to find help for these parents. We need to find We need to fund these research into autism, like what is causing autism, and then find treatments to autism. If we have the technology to put a man or like a satellite on Mars, right? If we have the technology to find a cure for COVID in a span of few months, if we direct money and technology towards autism, and I think we should be able to crack it before, before end of my lifetime.
Well, that was it for my questions, but do you have anything more to add before we end today?
I think I want to appreciate you, Nikhil, for what you're doing. And I think all these interviews that you're doing with healthcare professionals are going to help not only you, but also your audience. Thank you for having me today.
Thank you.
Thank you.